Today's talk, I want to start off with a brief overview of what I'm working on, so you have a good appreciation of that, and then I'll be talking a little bit more about one specific project that I'm currently developing. So as the title highlights, my area of work is on healthcare supply chain design. But the central argument that guides my program of work is that fundamental to healthcare supply chain management should be the acknowledgement that not everyone enjoys the same opportunities to access high quality, cost-effective, and timely healthcare. And in accordance with the Affordable Care Act, that this gap that we're observing in healthcare is not only observable in developing economies, but certainly very much a reality even here in the U.S. and other well-developed economies. So looking further into the sociology literature, we find that this gap is traditionally associated with socioeconomic position. Individuals who are in lower socioeconomic positions typically seek and obtain care in clinical settings that are oftentimes under-resourced and therefore have an impact on clinical decisions that can lead to negative health outcomes. So taking more of a macro end-to-end view of the healthcare sector, my work really takes us rather large or more macro healthcare supply chain view, which would traditionally link that development of care to the delivery of care. And I've been focusing more readily on the downstream elements of the healthcare supply chain and the healthcare delivery. Where I certainly particularly start by looking at the patient who ultimately needs to enter the healthcare supply chain to be readily treated for their respective condition. And then look at certain different clinical settings and key stakeholders that can make this healthcare delivery process work. Certainly been focusing a lot on primary care. Also looking at specialty care, in particular by looking at the role of behavioral health care through primary care. This recent project I'll be talking about is looking at hospital-based care, and also consider the pharmacy because a lot of disease conditions require ongoing treatment and medication. So certainly the pharmacy component should be considered. And then at the end of the day, all these different services must be reimbursed. Right? So therefore the payers certainly are a key stakeholder here. Now looking further into sociology of healthcare, we see that actually all these services don't really operate in a vacuum, but they take place within communities that can either hinder or enable these healthcare services from taking place. So most of my work certainly considers also the community context of where these healthcare services take place. And at the end of the day, we're really striving for this integrated healthcare supply chain that's ultimately patient-centric. So I have projects right now that are very much involved in these different aspects of this conceptualization of healthcare delivery. And again, today I'll be talking about one specific project and focusing more on hospitals. So this project is joint work with Gilbert Yaga and Gary Young here. So certainly been working through the Center for Health Policy and Healthcare Research. And in particular, we're looking at risk management behavior in supply chains by focusing on inventory management and hospital operations. So very similar to what Gilbert was talking about, there's certainly a lot of interest in looking at supply chain efficiency, and in particular, the role of inventory in the healthcare supply chain. So if we want to think of the supply chain, we've noticed that the complexity and uncertainty in supply chains has grown substantially as we start to source from and actually deliver to locations that are now very much geographically diverse, economically diverse, and socially diverse as well. So within the supply chain management literature, we traditionally try to address this, the gap between the supply and demand by trying to best match the supply and demand. And inventory traditional serves as a mechanism that can enable us to do that, given that it's very difficult to perfectly match the supply with the demand. Yet we run into certain risks associated with inventory decisions. Okay? We may get to the point of supply risk where we do not have enough supply to meet the demand. On the other hand, we may run into inventory risk, where we actually run out of inventory and therefore cannot meet. Or actually when we have too much inventory and therefore we get stuck with this obsolescence, right? And all the costs associated with disposing and so forth with this type of inventory. So in this particular project, we're focusing more on the supply risk side of inventory. But yet I do want to highlight that inventory has a long history in supply chains as a way to help us smooth the production and flows through supply chains. So there's certainly a benefit to inventories. Okay, so I certainly do not want to believe that inventories are always bad. Okay, so now focusing particularly in the healthcare sector, we see that supply chain performance is traditionally performing well, a lot worse than other industry sectors. So a very recent white paper by McKinsey and Company, where they compare certain supply chains such as pharmaceuticals and medical devices with some more well-established and mature supply chains such as fast-moving consumer goods. You certainly see that in the healthcare sector, we're traditionally carrying a lot more inventory than in some of these other industry sectors. Okay? We're getting stuck with a significant amount of obsolescence in medical devices and pharma components, right? And we've certainly seen that the lead time to replenish inventory is substantially longer in the healthcare sector. So as such, we tried to develop certain hypotheses that can help us explain why this may be certainly related to risk management behavior in supply chains. So we particularly look at the impact on inventory, right, in the hospital context. And we're focusing on supply risk. We begin by looking at the supply chain infrastructure. Okay? So really looking at where these hospitals are ultimately operating in and the supply chain infrastructure that they have at their disposal to ultimately source from, right, or use for sourcing. At the same time, we look at the supply chain demand. Ultimately looking more internally into these organizations, ultimately what's the demand for supply chain that they're facing. And we would hypothesize that locations that have greater transportation and warehousing infrastructure available for these hospitals, that they can ultimately better source and obtain shorter lead times to ultimately replenish their inventory, and therefore you should see lower inventories. On the other hand, when these hospitals are facing significant uncertainty as to the demand for supply chain, that they will tend to buffer it by increasing the amount of inventory that they carry. Now, for some potential strategies to help us reduce or buffer against these uncertainties, certainly in the supply chain literature, the whole notion of pooling risk. So if you can ultimately consolidate the inventory that you can have, okay, you can ultimately reduce the amount of inventory that you need in order to be able to address this uncertainty. On the other hand, we also have the strategic sourcing approach, where if you can actually establish certain strategic relationships, such as with group purchasing organizations, you can ultimately reduce this uncertainty. And then lastly, looking at the notion of resource dependence, that sometimes these organizations do not have as much power, right, over their suppliers to ultimately reduce their supply uncertainty. So therefore, we argue that actually those larger hospitals are ultimately being able to better manage the supply risk by exerting more power over their suppliers versus those that are versus those hospitals that are smaller in general. So we're currently testing some of these hypotheses using the California-based hospital in conjunction with some census-based data. And with that, I'll leave it open for questions and discussion.
Thank you.